At Nebraska Oral and Facial Surgery, you are truly in great hands. We will do everything possible to make sure that your experience with us is a positive one. With a typical extraction, there are some things that we would like you to know. You will be given a brochure with all of the recovery instructions before you leave our office. If you had sedation for your procedure, you are typically placed in our recovery area for 30 to 60 minutes while we go over instructions and you are awakening from your procedure. If you were given medication during the procedure, we ask that you bring a person with you that will be able to receive this information and drive you home safely. Immediately after the procedure, the staff will place large pieces of gauze in your mouth that will be changed by the nursing staff prior to your dismissal. You will be sent home with extra gauze and gloves for your convenience. We ask that you bite firmly on the gauze and keep it in place over the extraction sites for 30 minutes. It is normal for the gauze to be soaked with saliva and blood. Replace the gauze pack by folding the new gauze into a small, thick piece. Our nurses will be sure to show you how to fold the gauze. Continue to replace the gauze every 30 minutes for the first few hours after surgery. Resting with your head elevated and not exerting yourself will help minimize bleeding. If bleeding persists longer than expected, biting on a moist, black tea bag for 30 minutes can help constrict blood vessels. It can take 8 hours for the clot to fully form. Swelling usually peaks on the second or third day after the surgery and then begins to resolve. To reduce the swelling, we advise to apply ice packs to the outside of the face, near the areas of surgery, for the first 36 to 48 hours. This will also help in pain management. It is important to understand that you may have some discomfort following your surgery. That may be minimized if you follow the nurse's instructions. You will likely be prescribed a narcotic-containing pain medication to manage severe pain. We advise that you alternate this pain medication with ibuprofen for the first 24 to 48 hours. We also advise that you remain on ibuprofen and/or TYLENOL for the first 4 to 5 days after the procedure to help keep you comfortable as you return to your normal activities. Resume your diet after the procedure with soft, easy-to-chew foods like soups, applesauce, protein drinks, yogurt, Jell-O, ice cream, mashed potatoes, noodles, or eggs. Avoid all hard and crunchy foods for at least 1 week. We also advise to avoid using straws, sucking on hard candies, popsicles, or smoking for 1 week after your procedure. The suction action may dislodge the blood clot in the surgical site and increase the likelihood of a dry socket. Maintaining good oral hygiene is important after your oral surgery as your surgical sites are healing. You may resume your normal brushing and flossing routine the night of surgery, but avoid brushing directly over the surgical sites. If you received stitches or sutures, those will dissolve and fall out on their own in 7 to 10 days. On the day after the surgery, we ask that you begin salt water rinses to keep the surgical sites clean and promote healing. You may mix 1 teaspoon of salt with 1 cup of warm water and then gently rinse 3 to 5 times per day for 1 week following the procedure. If you were given a syringe for irrigation, you may use the syringe for cleaning the surgical sites beginning no sooner than 5 days after your procedure. The nurse will show you how to use the syringe. Irrigating is especially helpful after eating to remove food debris from the sockets. If you follow these instructions, you should have a speedy and healthy recovery. Of course, if you are experiencing any difficulties or have any questions as you are healing, please do not hesitate to give our office a call. We will be happy to answer any questions or concerns you may have. From all of us at Nebraska Oral and Facial Surgery, take care.